Hi, I'm Jay McCallum with Core Balance Therapy, and we're back with another one of our video series. I was so jealous of Colleen and Amy last weekend getting to do their presentation outside that I said I have to do one outside also. So at the request of one of our viewers, I wanted to talk today about activity pacing for patients with sort of persistent or chronic pain, which is a lot of our caseload. Anybody who's experienced persistent pain or been around people with persistent pain will resonate with the idea that just when you start to feel better, you start to try to get out and live life again and do things again, the pain kind of crashes back in again, and this up and down pattern, this boom and bust cycle is a real problem with patients who have long-standing chronic pain. It's really hard to get out of, and we think it actually makes the condition worse. So with that, what I'm talking about with activity pacing is how much do I do in a day? And by far the most common sort of strategy for activity pacing among my patients is I do as much as I can every day. I mean, I have a lot to do and I can't do as much as I want to do, and so I just do what the pain allows me to do every day. And the researchers call this kind of pacing symptom contingent pacing. So you're allowing your pain to dictate your level of activity, and it appears to lead over time to a decline in your capacity. So people do less and less over time, and they hurt more and more when they do symptom contingent pacing. So we really want people to not do that and to employ a more time contingent pacing strategy, a little bit more thoughtful, a little bit more planful. And there are several different time contingent pacing strategies that have been talked about. I use one that was originally designed for patients with fibromyalgia and chronic fatigue syndrome, and it allows a little bit of modification depending on how you feel, and that's what I really like about it. It's not a really strict, this is what you do every day no matter what. So when you're starting with this pacing, the first thing that you want to do is to get your symptoms stable from day to day. And the way that you do that is you stop and think about the activities during the day that you need to do that tend to make your pain worse, and how much of that can you really do without feeling worse from it the next day. And so we're going to say I can clean my house for half an hour, and if I do much more than half an hour, I am worse the next day. My pain is worse the next day, my energy level is worse the next day. And so we're going to call that 30 minutes kind of this X value. That's how long I can do this activity, and I want to do that for all of the different things I need to do during the day. And then when I'm trying to get my symptoms stable from day to day, I'm going to walk through my day, and on a good day, when I'm feeling reasonably decent, I'm going to do about 3/4 of X. So I'm going to do 20-something minutes of house cleaning, and I'm going to stop and I'm going to rest for about the same amount of time, or I'm going to do something else that's less demanding on me, and I'm going to come back and clean for another 23 minutes. And I'm going to try to avoid getting to that 30-minute threshold. On a bad day, when I'm feeling miserable, I'm hurting, I'm still going to stay active. I'm still going to try to do and live, but I'm going to do about half. So 15 minutes of cleaning, 15 minutes of rest, that type of thing. And that's what we call the stabilization phase of grading. Once you've reached a point where symptoms are relatively stable day to day, you want to start increasing very gradually. And with that, you're still doing the same thing. You're still saying, well, half an hour of cleaning is about what I do, but you go ahead on a bad day and you still do your half an hour. And on a good day, you do about 10% more, so 33 to 34 minutes of cleaning, so just a little bit more. And then every other week, you go back and you reassess. Well, what is it? You know what? I've really found I can do that 33 to 34 minutes of cleaning. It's okay, so that's now my new baseline. That's my new X, and I can work off of that and very gradually ease forward. So it's a real deliberate, thoughtful, gradual, pre-planned progression. You're always doing something every day. You allow it to adjust a little bit from time to time, but you really want to stay away from that. I did a lot today and I was crushed for 2 days and I couldn't do anything. That type of cycle is probably worsens the condition in most cases. So thank you for listening. Obviously, this is a horribly complicated thing. Activity pacing is hard for all of us, and so if you need help with it, feel free to give us a call. Thank you, and we'll talk to you again next week.